build customer
Meeting recording has started.
innovation, and engagement with all the stakeholders. The industry needs to drive and create a sense of urgency in implementing CX strategies because great customer experiences create great business values. So, now to start with our keynote session, I would like to welcome our keynote speaker, Mr. Saurabh Lakhanpal. To quickly speak about him, is an avid CX and EX advocate, having more than 18 years of experience in helping customers choose right customer experience solution. At Avaya, Saurabh provides strategic directions to the customers and account sales manager to devise digitalization and transformational strategies. So over to you, Saurabh, to start your session, and thank you for being with us today.
Thank you, Ekta. Welcome, everyone. And I'll just start with sharing my screen. And just a hygiene check. I am audible and my screen is visible.
Yes, you are audible
And
and very
I
clear
should
screen.
be visible now on the screen itself.
Yes, you are.
All right.
Interesting, yeah.
All right. Thank you, everyone, for joining in. And today we'll talk about the customer experience in the pharma and the healthcare industry. And when we talk about our world, we actually live in a VUCA world, right? A world which is volatile, which is full of uncertainty, which is complex, and there is a lot of ambiguity into it. And when we before COVID, around Feb 2020, the CX conversations that we were having with the customers were around the technologies, around the new age technologies like artificial intelligence or machine learning, natural language and processing for for making bots actually understand human language, going deep into the data, understanding big data, doing stats on that, doing predictive analytics, and all of that were there. And we were thinking of innovations for growth, and how do we increase the competitive edge while minimizing the business risk and controlling the cost at the same time. And before COVID, the shape of CX was around moving to the cloud from the on-premise solutions to migrating completely to the cloud, bringing in analytics to get the relevant data or actionable insights from the data that you have, bringing in AI into it so that the machine learning can be brought in with the data which cannot be processed by humans can be processed by AI, or bringing in automation, wherein automating some of the processes for all of the industries which are out there, and while keeping the system secure. And it was all around employee collaboration and customer experience. But then a 0.12 micron virus actually brought the world to halt, and it was kind of an unprecedented VUCA which occurred, right? And we all rushed to the rescue, right? All the people from the IT fraternity, or people from the business operations, they all rushed to rescue, right? We enabled the work from home capability, and then we ensured there is effective collaboration between teams, between customers and the people who are supporting them. uh, we implemented the remote agent concept, so that or remote employee concept, wherein the people who are remotely supporting different customers, right? Adoption on the digital channels increased multifold. Initially, before Feb 2020, the adoption on digital channels was not that much, and it picked up after COVID. And we built on automation, across different domains, and then security also. From a technology viewpoint, different vendors came in and provided the secure environments as well. But there was a new commotion, in the industry, or in the market. The collaboration was inefficient. It was not as if people are working from home, they would be able to collaborate better. There was the customer experience got scattered, because people who were providing customer service through agents, or through different employees, it got scattered into different homes. And instead of one office where they were supporting customers, now it became multiple offices. And there was network got overloaded, because We didn't created the network at that time because to handle that kind of load, right? And downtime increased at the same time with the security threats. And when we talk about healthcare industry specifically, there are separate challenges, right? The patient's expectations are increasing, right? uh, the resource utilization is always under pressure, and with COVID it increased multifold. The load on hospitals or load on the healthcare industry, we all know how much it was. And then data or the network security was at risk at the same time, because multiple people were there, and they were the access was from outside of the premises as well. And then there is a regulatory landscape as well, which is very extensive in case of healthcare industry, right? And the industry is transforming as well, right? With where mobile wearables, right? Consumers always share their data. They have that data available to them, right? They are more informed. The online world has made it very easy for health info to be searched, although it might not be very accurate at times, but people go online, they search for that information. The information is available around the drug conflict as well, if they want to, or the drawbacks of any drugs or allergies. There are different things which the consumer can now search online. And with millennials, almost 74% of the millennials actually prefer virtual visit. They don't want to visit physically to a doctor now after COVID, right? And at the same time, they want the better outcomes and experience. And to cater to this transforming industry and the challenges that healthcare industry is facing, we feel that Phygital is at the heart of the healthcare experience. Phygital is the way that we can improve the experience of our customers, the patients that we have. And innovation actually is already transforming the world of healthcare. We all would agree to that. While this is not a news in itself, innovation has always been a driving force behind the evolution of healthcare markets, right? We're now witnessing a new dimension of change. The two worlds are coming together, the physical and the digital world, and their convergence actually is giving a powerful new boost to the innovation. And not even industry experts would have thought that the healthcare industry would be a forerunner for a phygital change, right? All these years the industry was reluctant to change its business model, basically to incorporate the digital elements. It was one of the lowest spenders on digital adoption. And the reason for that could be that the industry actually was unsure how the end user would welcome the digital adoption. And when it comes to healthcare services, people actually expect more. They expect trust, they expect empathy, they expect care. At the same time, they expect the personal attention, right? And come 2020, things changed. Actually, things had to change, right? If we look at the Google trend data for online consultation, this could be a sign of change. I think in the end user trend. Uh, Minimum contact is the rule of 2020, but people are willing to trust a virtual doctor consultation nowadays. And for the healthcare industry, this is not a digital application. It's how they're addressing the pain points of the end user. The change is happening at multiple levels within the healthcare industry. And at Avaya, while actually during the second wave, we came up with this website by the name of Medic Setu. Basically, it's a non-profit website which we created for online consultation of COVID cases. During there was a lot of load was there on the hospitals, and it was a virtual OPD completely. And there are around 160 doctors who are registered for this. And around more than 1,000 patients were consulted with more than 4,500 consultation minutes there. And why we are saying phygital, or why at Avaya we think phygital is the way to go, because it actually facilitates the healthcare experience throughout the care journey. It starts from the admission to it goes to the treatment, then while discharging, or transition of the care from one healthcare provider to another healthcare provider, or doing a post discharge follow up, uh, doing preventive measures after the follow up, and then providing customer service and ops on top of it, right? And not just digital, I think there are two more concepts which will provide benefit to the healthcare industry moving forward to improve the customer experience after we went through COVID. Another one is an automation, wherein visual automation can be provided to the users. Visual automation can be, a workflow can be created, and through those workflows, basically different information can be provided to the users, to the patients. Doing validation checks, or identifying a patient, those kind of checks can be automated as well. Doing a callback for the users when there is less load for the healthcare service provider, right? That can be provided automated completely. And then bot functionality can help really solve the customer experience while providing the automation as well. Now those voice bots, the bots can be over the text on digital channels, or it can be a voice bot wherein I as a patient can call up a healthcare provider and can converse normally to a bot on the voice itself. Second, I think the proactive measures would make CX improvement at the healthcare industry very well. And basically doing automate appointment reminders, proactively sending those to the patients that your appointment is at so and so date and time. Please be at maybe 10 minutes before the appointment time, or 5 minutes before that. Or doing a post procedure follow up, or pre procedure follow up for certain guidelines which needs to be provided to the patients. Running targeted campaigns, basically for from a region perspective, proactively reaching out to those regions, and giving information on the cases that are coming up. So example could be, currently dengue cases are more in nature. So a proactive communication can be sent through healthcare providers to the the patients of theirs, that dengue cases are on rise, and take these precautions while you are going out or at home. So I think these three, digital, automation, and proactiveness are the key to improve the customer experience in the healthcare industry. With that, I'll take a pause, and would like to invite all of you guys as well, for a workshop session, maybe with Avaya, wherein we can validate what are the key business challenges that you are facing, or maybe facing, and identify if there are opportunities to what is your current state, and what is it that you want to be in the future, and basically provide you a roadmap on improving the customer experience for your patients. With that, I'll take a pause and see if there are any questions around the technology piece. I'll be happy to answer those. Otherwise, Raksha, over to you. Sorry, Ekta, over to you.
Yes, yes, no problem. Thank you, Saurabh, for sharing interesting insights. So, as Saurabh mentioned, do we have any questions? We would definitely love to take it. So, you can directly pop in your questions to Saurabh here.
Soro, hi, this is Samir. Can you hear me?
Yes,
Yep,
Samir, please
Sabir.
go ahead. Yeah.
Soro, interesting presentation on well structured pre versus post COVID and how the technology can play a role. My question to you, I mean, just for my information, from a technology provider's point of view, what are
Mhm.
two, three important insights or the challenges that you think that can help as any organization which we once added to the technology piece, like the platform which you're talking about, can add a lot of value to the end patient.
Let's see. One is which I think can add value is provide through technology is one which we also implemented was virtual consultation. Providing patients that
Right.
capability or that comfort from their homes, that they are not exposed to the external world, while they're consulting with the doctor, right? Because I myself was a victim of that. I had a cough and cold, not really COVID. So I was very reluctant to go to the doctor at that time, because I was not aware whether it is COVID or not, until and unless that report came in. I was in a scared mode. So basically, providing comfort to the patients is one thing I think which is very relevant. Second, I think if somebody is in healthcare provider care itself, and I'll again take a example of COVID itself. People were not allowed to go in to see their patients, and there was so much chaos outside the hospitals at that time. So around video consultation itself, it can be provided between the between the patient who is there in the facility, to the person who is outside as well. So doing a video clarification between these two, or video calling between these two. Now these can be done on WhatsApp or other things as well. But when we talk about technology, it basically can scale to different levels, and it can be provided uh, through service providers to their patients as well as a service.
Yes. Do
Thanks.
we have, yeah. Thank you. Thank you, Saurabh, for answering the question. So, do we have any more questions with Saurabh that anybody needs to? Okay. So, of course, Saurabh is here. We have an interesting panel discussion, and definitely we'll take more questions coming in. So, thank you, Saurabh, again for sharing your insights. Now, moving to a roundtable discussion, which talks about need for customer-centric digital transformation technology to improve CX. And today we have interesting panel speakers who are going to share interesting thoughts on the same. So I will introduce all the speakers and then I hand it over to our moderator. So we have Mr. Samir Srivastava, Vice President, Alkem Laboratories. We have Mr. Rohit Garg, VP Business Excellence with Alembic
We
Pharmaceuticals.
lost your voice.
Am I audible now? Yes, thank you.
Samir, sorry, I think the problem is at your end, because we are able to hear Ekta clearly.
Okay, okay, no problem. Then we have Mr. Rahul Avasthy, lead digital transformation and experience from Abbott. And not to mention you all, Rahul has, taken the special pain to join us from Chicago. Thank you so much, Rahul. I know it is an odd hour and still you managed. Thank you for that. We have Dr. Pramod the Kumar Rajput, Vertical Head and Senior Vice President with Cadila Pharmaceutical. We have Mr. Vaibhav Rao, Digital Client Partner Asia, Pfizer. Mr. Shankar Sain, Executive Vice President, Cardiometabolic SBU, Intas Pharmaceuticals. So thank you all thought leaders for being here today with interesting designations and looking forward to a very interesting this panel discussion. And now I would like to invite our moderator, Mr. Vishal Thakkar, Head Unified Communication and Collaborations with Avaya, to take it from here. So over to you, Vishal. And thank you for being here, everyone.
Good afternoon, everyone. I hope everyone is doing excellent. I'm just checking you can see me and hear me.
Yes, we can hear
Okay,
you.
excellent. That's wonderful. Okay, so we are going to hear from our panel members about the need for customer-centric digital transformation and how technology can really improve the customer experience. And thanks a lot, Ekta, for introducing the panel members. And just quickly checking whether we have uh, Prachi Mohapatra already joined because I knew that there was some gap in terms of she was running uh, through some time challenges. So just wanted to check if she's not there. Maybe I'll just quickly start and carry on.
Yeah, due to time challenges, you rightly said that she won't be able to make it. So she has apologized for the same. So you can carry on, yeah, with our other
Okay,
thought leaders. Thank you.
okay, thanks, Ikta. Okay, so we are going to start with some inputs from Mr. Rahul Avasthy on on what are the strategies needed to implement a robust CX model. So, Rahul, I would like to share your inputs on these strategies which are needed to implement a robust customer experience model.
Sure, of course. Thank you, everyone, and thank you for the kind invitation. And very good morning from Chicago. The sun is not here yet, so you have to send it from India. Waiting for it. Uh, it's an interesting question, right, on these strategies. I believe one thing that we all, I believe, will agree that, the technology has completely altered the customer taste, the memory of the product, the memory of the experience has now become the new product. I recently sold my car. It was an online dealership. I basically went ahead, entered my VIN number, and I think they used data and AI, and they gave me the offer on spot. So there was no manual person who did the inspection. It was all based upon trust. It was all based upon the credit score, and that's it. The kind of offer was directly out there. Um, so you see how the memories of experiences are changing in kind of a big way. And again, technology is playing a huge role around that. Also, the customer loyalty are shifting towards experiences, right? And I always say experience is as good as a good technology underlying behind it, right? So yes, you can enable all that, but you need the right tools to make sure that possibly happen. So one of the key strategy point I would say is it's very important to have a value driven strategy whenever you're looking to evaluate technology, whenever you're looking to do the customer experience around that. Because very important part, right? Imagine you if a company disappears tomorrow, who actually will miss it? Is it your customers? Is it your vendors? Is it your employees? If they're not, and if nobody's missing it, then it means that there is not enough difference being made in terms of value. And I believe without a meaningful difference, the company has a little chance of earning returns in excess of cost of capital, right? Another point I want to make is in terms of strategy, is it is not a customer experience strategy if you're not able to charge premium for it. So it's very important to have the right value stick so that you're able to charge the premium for it. It should actually deepen that company's competitive advantage, and the kind of experiences that you are delivering with the right technology and tools, it should be very hard to imitate. So another key point I really want to stress about that is, apart from the value and the memories as kind of experiences, it should be very hard to imitate, and you should be able to charge possibly the premium for it. I think a last point I would talk about is, and one of the helpful tip which I have used a lot, and I've seen the peers using a lot as well, is it's the time to start thinking customer journeys as a service. We already have entered the experience economy. We were in goods economy, then service economy, but now we all have entered the experiences economy. And a lot of people are predicting the future is a lot about the hyper personalized economy. So the more we are shifting from that mindset, it is very important that we are creating that connected ecosystem. We are creating that connected network effect, and we are trying to do that in an effective fashion. Sony came out. I'm a very heavy Kindle reader. Sony was the first one who actually came out with the ebook reader. Beautiful product, but they did not have the right technology to connect to it. I remember I have to connect my Sony reader with a laptop with a very limited app store to actually get the book. Beautiful experience of reading the book, which Kindle still doesn't give. But when Kindle came up, it was just one click and everything was over the air. So it's very important on that seamless ecosystem so that you can possibly go and create that network effect. Um, just to add on, I would say to sum it up, remember that ABCD, right? Do not make your customers angry. Do not try to change their expectation. Do not, the B would be the broken expectation. Make sure there are no broken expectation. When you're there, you are trying to deliver so they don't waste their time around it. The C would be confusion. There's a lot of time confusion happens. I have returned a product. Is it returned? The website doesn't say return. Is the money coming back? Is it not coming back? It still says order. So a lot of time the confusion creates all of that. And you need a lot of integrations and technology to possibly go and make that happen. And the last is distraction. A lot of time, sometimes I've seen is what companies really want to flaunt, showcase is not really what customer wants, is in fact distracting. The most eye-catching element on a certain customer touch point may not be the one that the customer wants to know. Is more about what the company wants to know. So yeah, I remember those key pointers and the ABCD. That has helped me personally a lot. So I hope it will help you all as well. Thank you.
Thanks, Rahul. Appreciate your inputs. And now I would like to ask Mr. Vaibhav Rao on what are his views on the strategies needed to implement the robust customer experience models. Yes, Vaibhav.
Right. Yes. Hi, Vishal. Am I audible?
Yes, sir.
All right. Thank you, and thanks everyone for tuning. It's Friday afternoon, and thanks for your time. Yeah. So and on this interesting topic, right? And it's all come to the forefront in the last 18 to 20 months. It took, as Saurabh was saying, a small virus to actually make us think what our customer really wants. We've seen in the last 18 to 20 months. Our customers from a pharma or healthcare perspectives, our doctors or our patients, have moved on to a lot of other alternate channels than face to face. Right? It's all digital or more towards digital channels that they were adopted. Our doctors, for a case in point, right, are looking to meet our reps or sales reps only through virtual channels. They prefer doing that. And that's not the only touch point for them. They're actually doing their CME accreditations online. They're also visiting some of these events online right now. These are virtual events which they're part of, symposiums or congresses that they're now part of, which is virtual. Also, and importantly, and Saurabh also actually kind of mentioned that, was there is a lot of teleconsultations which is happening. Most patients prefer that as an option. And interestingly, I was doing this stat, and I found that across emerging markets, right, in the world, the teleconsultation number has grown by more than 500% over the last 18 to 20 months. So you see the extent of digitalization that our doctor is actually exposed to, and that's our customer. And what did we do by the reaction? I would say a reaction, quote unquote, as an industry, we followed them digital and through all touch points possible, right? We didn't leave any. So it could be emails, it could be virtual calls, it could be through webinars. But while doing so, did we think, are we being empathetic towards the doctors' actual needs? Are we being empathetic towards the channel that they prefer to consume a certain type of content? Are we personalizing to an extent? Well, to an extent we did, but not to a liking of maybe the doctor that he was actually already bombarded with so many digital touch points, which kind of led to very suboptimal CX, right? Or actually poor CX, which actually the doctors walked away from certain channels, kind of shut that channel for good. For other companies who actually took the brunt, who are actually doing good in that space. So that's not a good service that we've done for an industry overall. So which is why I think I truly believe, right, taking a step back, if you were to build a good CX model or a good strategy, the business objectives of an organization or the have to be ingrained or have to be, with the end experience which they're actually giving to their customers, be it patients, be doctors. So it has to be there. And more than, I would say, customer aware, as we say, right? How much do you know? Being actually customer led or being customer obsessed. I mean, that is where it starts. So if it's a culture that embraces this as an organization, then I think we made a good start. So I think, thankfully, though, the pandemic has taught us these points, and we got feedback out from our customers who are actually demanding better CX. These are same people who are getting amazing CX when they're actually interacting with the Amazons or Netflixes of the world. So why not expect something like that from another partner who's actually trying to mimic their service? So it's a fair ask. So I think we're gradually learning. One good example, right, in terms of culture, is a non-pharma one, and I think we should also learn from the other industry. There are ways way better that they have done in terms of serving their customers. It's about a bank in UAE. I think it's called Emirates NBD, which is based out of UAE. What they were doing early on back in 2012 or 2013, they were celebrating one day of the year. I think it's the first Tuesday of every October, and they used to call it CX Day, right? Or something like that. So customer service day or something, and it was only celebrated for their call center contractors or employees. And they would just gather some feedback, some CSAT scores, what the customer said, and nominate one of the employees or the contractor as the employee or a contractor of the year, and that's it, right? It's just like a motivation. Interestingly, there was no one else or the employees who were actually part of this, and suddenly they felt, let's also involve some of the employees who are customer facing, like the sales colleagues typically, or the marketing who are actually customer facing. And in as part of the CX Day celebration, then they understood, okay, there is what our customers are actually trying to tell us. It is not just the call center, but there are sales colleagues who are actually also coming in and giving us this feedback, right? So then this whole CX day translated into something called as a CX week for that organization, and more functions in the organization started getting involved, right? Even for that matter, a digital team or who's actually never customer facing, they're actually developing websites or creating experiences virtually. They're never exposed to the end customer. They were actually invited to actually come and talk, come and share their experiences, because they are looking at data, right? Data never lies, and it's giving you the truth in terms of what the customer is actually liking, enjoying, or not liking, etc. So that also started coming in. And what happened then, and this is how the culture is, right? And then they said, okay, now let's put a formal vision of CX for the organization. And since it's a bank, they actually led it on three main factors, right? And one of the big factors was trust. The other one, which they really focused on, was ownership, and the last one was personalization, right? These are three factors that they actually created the whole CX culture in the organization. So any customer interacting in any format, be it directly to a customer facing contractor or an employee, would experience these three things: trust, in terms of the processes, in terms of it being transparent, it in being secure when they're actually banking with this organization or this bank, ownership, or which means accountability, that every employee or a non-employee takes in terms of giving the best possible customer experience to the end customer, right? And the last one, personalization. So it's basically bringing in the empathy, right? Are you giving the relevant content? Are you or the service, or are you actually being empathetic towards to the end customer? Are you giving him or her a content or a service which makes their life easy or improves their life? So this was built in. And uh, from a CX day to a CX week to a CX month, right? So they grew, and they celebrate the whole month of October as CX month, where the whole month is divided into different, three parts or 10 days, in which every employee comes and contributes in from their own areas or own functions as to what works, what doesn't work, and what they can do to improve. And the organization takes this seriously. They award such people who actually come forward. They test this idea. They do a very quick A/B testing. They find out what is working, what is not, and then they just go and implement and collect feedback. It's a continuous process to build a culture around the organization. So just to conclude, right, my submission, it would be, it starts with the culture, actually. Basically, if you really want to create a good CX model, it has to be culture, a culture which is moving from customer aware to being customer led or customer obsessed. We've seen another example I like to bring is an SAP, right? And SAP actually co-creates their solutions with the industry leaders. They would actually invite people to actually co-create a solution, and for the industry. So why would a customer not like it if that's their own creation, right? That's already built in that sense of ownership and pride, right? So another one, and very fundamentally extremely important, is being from being data rich company to being insight driven, right? We have all data with us. We have so many websites, so many apps, so many touch points, be it digital, non-digital. That data comes back to us. Are we able to draw, I would not say a customer journey map, are we able to draw an empathy map using this data, right? So what is the customer thinking, what is he feeling, what is he doing, what's the experience like before and after data never lies. It tells us that story. So are we able to take these insights and actually go and make that experience much better? And last 2 points would be, we are always looking for perfection, right? We are pharma, or we are healthcare. We never want to compromise on anything. But when we are looking at customer experience, can we do something fast and do an A/B testing, see if it really works, and then build on that? Can we move from waterfall to agile to test market some of our functionalities or features that we got to get to the end customer? And towards the end, from being siloed to being connected, right? So are we able to build an omni-channel ecosystem that basically talks to each other at the end of the day, is able to serve our customer better through different touch points, be it digital or non-digital, be it an employee or a non-employee? There are touch points or experiences that we create for our customers, which actually is the perceived value of service or product that we're giving. So that would be my submission. And thank you again for this opportunity.
Thank you, Vaibhav, sir. I think very interesting observations and complementing what Rahul Avasthy sir said just before you. And so I really appreciate your views. My next question would be to Mr. Srivastava, and we would like to hear, sir, from you about the importance of recognizing the challenges and adopting customer-centric strategies to adapt to change. So over to you, Samir.
Yeah. Hi, Vishal. Thank you so much. And I guess what Saurav has talked and what just now Vaibhav was talking is like in sequence, and then is building on of that. And I'll just take up what just now our friend Vaibhav was talking is about internal, external, all omni channels are talking to each other. I guess in your question, the first important point is recognizing is a very, very key factor. While I was, going through the entire agenda and all those things, I was just trying to understand that what is more important. I guess it starts something from within the company, and it starts like Vaibhav was talking about culture. It doesn't start with the people like employees. It starts with the top management, how they are involved in order to create that kind of environment or the ecosystem. Am I audible?
Yes,
Right.
sir.
So the idea is how are they aligned, how much they agile, and they understand the importance of having technology and the speed with which the customer is changing. I remember Rahul was talking about no, the speed with which the customer experience have changed is huge. And I'm not talking about anybody else. I just only referring to myself. The way I used to behave 5 years before, the way I was behaving before COVID era. I mean, the before we said before COVID, so BC, as we used to talk now in our colloquial language. And today, if you look at it, the entire experience has changed. And therefore, what is important when you say recognizing challenge, I will divide this into two basic parts. One is our internal. The first part is the mindset of the either you call it the CXOs of the team, or the owners, or the whosoever is running the function. How strong is the IT team or the digital team or your customer experience team? So I have seen the companies have a digital team separate and the CRM cells separate, and they hardly talk to each other. So that itself is one of the biggest challenge I've seen. Internally, how do we align the structure of an organization is one of the very, very key important factors for us to understand where the challenge is lying. So this is, and thereby the developing the agility of the team to understand the customer per se, how they are changing, what is their experience, or whatever the Rahul and the Vaibhavs of the world has talked. But then internally, how organization is speeding up their own employees. I'll just give you example. Recently, I'm buying a couple of white goods for myself, right? So we go to the Amazon or the Flipkarts or the IKEA of the world. I'll just use the example of IKEA here. So I typed something, got the stuff, went there, and he was like, "Sir, you must have seen our app, and it is exactly as per same. So whatever you finalize there, it is coming out exactly here." And similarly, in Bombay, we have one of the very predominant stores, which is called as a local one, but then it has spread across. When I went and talked to their people, I said, I seen that product on the online. Are sir, online chodiye. And forget about that online, the app, what you've seen. I'll show you what I have, and this is the best. And so what I'm trying to bring it on the table is that one side, the organization is developing and trying to develop a customer experience that you come to our web or an app and find out a product, feel it, experience it, and then it can be either shipped to you, or you can come to the, to the shop or to the mall and then buy it out. But the employees there is not, aligned to that strategy altogether. So recognizing challenge in part which you're talking is, I guess, first is we all leaders and maybe our seniors, they have to understand the importance of training, developing internal people to be part of that. That's a point number one. When I move to external, I guess what I just heard is our people is like today any customer you look at it, whether it's a healthcare, pharma, or a non-healthcare segment, it is called always on customer, right? We are always on, all internet on, the information is at any given point of time, the huge information is flowing in for us, and we all see everything. I mean, like it is called as mobile first. So everything you heard something and we are on it. So the idea is that the customers are changing, are very speed in a very faster way. However, in the internal as an organization, we are not aligned to the speed with which the customers are changing. And that's where when Rahul was talking about the experience economy or having a hyper personalized stuff, I guess there what is the most important thing for all of us to understand is that we need to adopt to change is more important than just thinking of change. People are thinking of change for sure. That is what COVID has done. But if you look at the continuum in a non-pharma, Amazon kind of pieces, retail segment, you see the lot of changes happen. In healthcare space, with Apple and the Google using a lot of AI and information and data insights, and in fact, whatever you talk, whether you sleep, every data is with there with Apple or the Google for that matter. So they are using that to bring out multiple things. They are using your heart rate, arrhythmia, to predict the arrhythmia, to predict other things. So they are coming into healthcare space much more stronger using the very strong data. But when you come to the pharma space per se, as Vaibhav was talking, there was a bombardment happened suddenly. As come March, April 2020, there was a bombardment started at doctor. Initially, every doctor started watching it, and then they said, "Boss, that's enough." But I tell you, Vaibhav, what I've seen in there, we had a one channel in the pharma space. This was a very hardcore customer knowledge channel. It is a knowledge reservoir we created, and this we created in 2017, and we grew over a period of time. And there I was reflecting in customer experience per se. I didn't realize when I was developing that at point of time that I'm doing this because we were taking the feedback from the customers. We were connected with the customers in the entire his experience on that platform, and we were keep on evolving that. When today I was going through the different model, I was doing my study materials and all, I was going through the model, I was finding that platform was fitting it. So what we did is we developed with around 200 doctors coming on that platform. But what we did, not a single pharma company person was there except me and my digital team. The communication which has gone from all the angle to them was, boss, this is your channel created for you by your people, by the doctors. So this is the content we were creating. A lot of knowledge was coming inside, and that becomes a reservoir. People, whenever they want, they could have seen that, and they are taking that entire knowledge and we developed the content. There's a good amount of content was created, and as the newer content was coming, we saw that almost of a universe of that specialty, we had almost 75 to 80% of universe was available on that channel. And out of, let's say, 8,000 odd doctors were there, we had 2,000 active participation. Even November, December of last year, we had that level of participation. Now, what I'm trying to bring it is that we always think that we are thinking what customer is thinking. It is only in my mind. It is not in execution. And fortunately or unfortunately, there was a huge pressure on our BU heads and the marketing team is that create something digital, create something digital. There was a tick mark job was happening rather than actually in engaging the customers and taking forward. My event was successful because it was not that I developed that point of time, because I had a legacy of 2 years experience on that. So 2017 to 2020 March, 2017 October to 2020 March, 2.5 years exactly was that experience. So when I looked at that example, now I just develop a process that how we should being get into that, and that is where we as a leader we need to work it out. The and these are very known things. So I mean the people are very knowledgeable who are sitting here, and maybe any audience, any guy who has done his MBA knows these things. I'm just trying to structure it, put it again for just to refresh this thing. One more thing which you're talking is that being aware. Now majority of the things what I've seen is I've come to an organization where we are talking digital, but we are not in social media. We don't want to be on social media. I cannot pick and choose because of my priorities. I have to understand what customers want. Today on Twitter, there is a community called Med Twitter. If you don't connect with them, if you don't connect in the Insta with them, I mean, with similar kind of profile, you're not in the game. Facebook is very old, though there are doctors. But as a company or as a strategist, can I adopt those kind of things? I will not choose my preferences. So I should be being aware in terms of that what kind of customers I am referring, who's my target segment, and what is their methodology of getting those points. So somebody used the word called omni channels. If I am missing, let's say I don't have chatbots or video calls or any for that matter anything. If I don't have presence on anything else, then I am not aware of what my channel, what my customer segment or what my customer preference is. Once that. Second point on that being aware is that about knowing them. How is my team? See, I talked about internal team training and making them aware that digital is important. See, as a company, we were doing a lot of digital program, but down the line, my manager used to come and said, "Sir, why are you wasting time? Doctor doesn't listen these things, sir. Sir, I will go and meet him, and he want this kind of service rather than listening to these things." Now, these are hardcore pharma challenges. I have a
Absolutely.
more mindset issue within the team than the customer, and it is not one company, one one company or two company phenomena. I've been interacting with my colleagues, and I can tell you, I have a friend who has still an MR. I have a friend who becomes CXO. So I mean that is spread. I'm talking to you, and we luckily were working from home, so we always on phone, so we get that. So knowing the second part was knowing them. So learning more about how the customer comes to know about you, your product, your services, your engagement, and is all channels talking together on the similar lines, communicating the same value system. And that's where there's a requirement of of an organization model which has the digital, customer, marketing, everything syncing to each other.
Absolutely. I think Samir sir, you're spot on, and you have touched the interesting another points while we are talking about adopting customer-centric strategies. Yeah, and thanks for your inputs, by the way, Samir sir. Wonderful. And now I can see that Mr. Rohit Garg is also there. And my next question is to Mr. Rohit Garg. And sir, we are going to hear from you about the building unified experiences across channels backed by customer research. So over to you, Rohit sir.
Yeah, thank you. Am I no audible? First of all, can you
Yes,
hear
sir.
me? Oh, great.
Yes.
Thank you so much, and thanks for inviting, and thanks for your time. On the channels, first, I think I will first define what customer we are talking about. So, as a pharma industry, we are little blessed to have two kind of customer. One, the customer that we interact with, mostly the HCPs, and then the actual consumer, which is the patient for which we all work in a healthcare system. So both are actually important, and both are very important customer in this whole ecosystem. So if I talk from the HCP window, who are the core customer for the pharma companies, I think a lot has already been said. How we can provide them the experience through the digital channels. But I would say that if I were to provide a unified experience across channels to my HCPs, two things are very important, two capabilities that any organization need to build. And those two, which I think we all hear in various forums, are data and digital. I think, I think all lot of books have been written, a lot of people keep talking about it, but I think that's the the core reality, that until unless the organization leverage the capabilities of data and digital in today's time, the experience that you want to provide to your customer, I think without those two capabilities, it will not be the up to the mark. So let me talk one by one. One is on the data side. So why it is important? Because when you're providing a unified experience to your customer, first you need to understand your customer. And how do you understand your customer? You understand your customers only by analyzing their behavior, segmenting them, understanding where they come from, what are their likes, their dislikes, their preferences, their behaviors, and what channel do they prefer. Not every customer is digitally savvy, and not every customer is completely digitally agnostic. So they have their own various and likings and dislikings. So you need to understand your customer, reach out to them, the time when they want, the channel through which they want, the content they want to hear, and then only you will get their mind share in this cluttered market. So I think the data helps you analyze it and really put in very focused effort on where you should catch your customers, when you should catch it, how often you should catch it, and what you should talk to them. So that's the data. And then comes the digital part. Digital is as my previous speaker said, is something where the customers are slowly, especially during the pandemic, there is a digital fatigue which is getting set in. The companies are bombarding them with all kind of digital channels, right from SMS to WhatsApp to wherever they find them, email, you name a channel, and companies are just rushing and catching them. So I think the companies need to be very smart, that if the digital fatigue is setting in, how do I innovate uh, myself in the digital channel, that I am not creating extra clutter in the minds of the customer. So there you need to come out in terms of your content, which is very very relevant, informative for the customer. You have to understand that they also don't have much time, so you need to be very sharp and crisp and focused in your communication. So the organization which can harness the entire capabilities around the data by understanding them, and also deliver those messages digitally using the right channels where they are present, those customer present, I think those organizations would kind of compete better in today's. Then second is, so these are my HCPs. Then comes my actual patient, for which even the doctor is also working. So a lot of has been said about the patient centricity. How do we put the patient at the center and create the whole ecosystem around the healthcare to serve the patient, which comes, I think, through many ways, right? From the diagnostic services to many employee health records, to many kind of pill reminders by the pharmacy and pharma companies, a lot of patient camps, a lot of things have been done around the patient services. So now we are not talking about, from the pharma marketing point of view, we're not talking just about the pill. Now we are talking about the pill plus. How do I create the whole ecosystem of services around the pill and serve the patient and provide him a very unified experience, whether right from walking into a hospital or a physician chamber, to pharmacy, to a diagnostic center, to the insurance reimbursement. How do I create that experience for the patient? So I think these are the two ways. I think these capabilities, these organization, when they can leverage and master them, they would be the one who would be able to really provide a unified experience to the patient and the doctors.
Thank you, sir. Thank you, Rohit, sir. And appreciate, I heard that there was some medical emergency for you, and you
No,
still were able to.
perfectly fine.
Thank you, sir. Okay. Now, my next question is to Mr. Sankar Sen. And sir, we would like to know from you about the models that use tech and big data to enable decision making and strategizing to reach customers.
Thank you, Vishal, for having me. And let me first put on record my pleasant surprise in getting included in this eminent panel. I was very listening very intensely to what the previous speakers had to say. And of course, I have got those nuggets which helps me build my case further. So here are my humble submissions. Uh, Models. So before doing that, I will quickly take you, I'll break it into three parts so that we are all on the same template and we take it gradually. We will first talk about models that are already deployed, which means that they are available off the shelf. We can plug them, do a little bit of customization, and actually play them in our patient care setting or customer experience settings. Models that are expected soon, and models that can change the way we think about customer experience in future. And of course, I will also be talking about some models which I find a little bit far-fetched. I mean, these things are a bit too much into the future, and probably there is some gap uh, between now and the time when we will actually see them getting implemented. So first, the deployed ones. Let us take it again stepwise. The point of entry of a patient to a setting. So I'll give you examples of models which are already available. There is this small startup somewhere near Jalandhar who sends individuals with laptop, a BP measuring instrument, and a digital glucometer to towns that are about 100 kilometers away from the district headquarters. What do these gentlemen do? They hook up at a place either in the village chopal or sitting at the house of the sarpanch of the village, does random blood pressure and random blood sugar checks. And for all patients or all people who are diagnosed as patients, they have empaneled doctors who do the consultation. A prescription is generated, that prescription is handed over to the patient, and the patient can go to the nearest medical shop and get a treatment of at least hypertension and diabetes. I think this is the real Indian way of looking at reaching out healthcare with the help of technology and ensuring that the main enabling factor of technology, which is democratization of any service, this is a fine example of it. Imagine a situation where a patient walks into a hospital and he doesn't know which department I should go to. Now, today, there is a 24 by 7 AI virtual assistant and digital front door solution available for health systems that would help a patient navigate to the right care setting within a multi specialty hospital. That is already available. If you want, I can read out the name for that. That is available. So, that model is available. The next, from point of entry, the next thing is diagnostic. If I remember correctly, about 2 weeks ago, the FDA has approved something called page prostate. What is page prostate? Page prostate helps the pathologist to accurately and efficiently find the prostate cancer. Tremendous equipment that helps to quickly determine the extent of the damage to this vital organ, and then the prognosis takes up from there, and the treatment modalities can be designed from there. Talk about integrative options that are available. Now, God forbid it, if we have a patient at our house at different stages of the disease or at different stages of our lives, we go to different doctors. Then in each of those doctors, we create or we generate a healthcare record. What happens if somebody can put all those healthcare records into one place and create a personal health record, which is a consolidated health record for the entire person in his entire journey of a particular disease or his entire journey of life for that matter. There is a model available, there is an app available, which we call One Record, which is capable of doing that. So that is already available. Moving forward to some assistive technologies, imagine we have a neurological patient who requires exercises to be done for his physical and cognitive therapy. Today, there is a AI assisted model available. We call it Neuro Rehab VR. It uses virtual reality and ensures that neuroplasticity is restored for recovery and allows specialists to track their patients in real time. These models are already available today. Let us talk about some models that will be that are expected soon. And one of the greatest ones, surprisingly, is probably going to be expected very soon here in India. I think all of us have already heard about the Ayushman Bharat digital initiative or the digital mission. So it is a QR code based, Aadhaar authenticated model for sharing of the personal health record of patients. It follows the data empowerment and protection architecture, thereby ensuring that you do not have any challenge of data integrity or data leakage. And moving forward, if I have read what Mr. Nandan Nilekani had to say about it, I think we are moving forward towards something like a unified health interface, which would be something like the unified payment interfaces that we have. So as a patient, you need not worry who is at the back end of it. Your experience is extremely smooth. So you can connect to any doctor, you can book an appointment, you can pay the fees, you can share your personal health record, you can determine which portion of the personal health record you would share and for what amount of time, get a prescription, everything will be done. In all probability, these unified health interfaces, I think we will start calling them by their acronym of UHI, will be developed by private enterprises. So the doctor, the patient, which means you and I, we will have a choice of which UHI I use and which UHI you use. That is already being visualized, and I think it is very much possible in near future. I think Rahul was talking about a seamless ecosystem. If we manage to put it on practice, I think Ayushman Bharat Digital Mission will be a wonderful experience of having a seamless ecosystem.
Yeah,
But then at the same time,
yeah. But like these will definitely help, enabling the decision making and strategies to reach out to
absolutely,
customers. Yeah.
absolutely,
Sorry to cut you here. We are just running a little short on time, so
I understand.
you if time permits. My next question is to Mr. PK, Dr. PK Rajput. And sir, we would like to know about your experiences and views on customer journey mapping. How basically how you can turn failures into building blocks for success. So over to
Thank
you.
you. Thank you so much. Good evening. I am audible.
Absolutely, sir.
Thank you. So, first of all, thank you so much for inviting me on your wonderful platform. I was really listening with Mr. Saurabh Lakhanpal, the way he said, and Mr. Rahul Avasthy, he said about the customer journey. So, I will connect all the beautiful nuggets which are there, which has been spoken by the people here, right? And then Vaibhav Rao has spoken about the digital connect, and he very well said that data is the oil, where technology, I always say, is a god. So the combination of the data and the technology always blend the things to make the things ahead, and it is a basic requirement. And Mr. Sameer has said about this alignment, agility, and the technology. Again, the same thing. Rohit ji has said about the SCP as well as the patient part. So taking the things, and again, Mr. Shankar Sen has said about the model available expected in the future. So I will talk to you about another very important thing, because now how we have seen the patient is getting changed. The journey with the realization which has come, it is not quite right. A trip to the doctor may be in the odd, because patients are moving through the journey by interacting with their primary care physician to a specialist, pharmacist, and finally the product itself. You will all agree with me. But now, optimizing how we as a company fits into the digital patient journey is an important integral part of a smart pharmaceutical marketing plan and an amazing patient experience. So if you see that which way we can make the things happen, the journey will be defined in the three goals, frankly speaking: engagement, advocacy, and adherence. When we talk about the engagement part, which is again very important, that how the pharma marketing is little different, because we know that lot many things are there, but the pharmaceutical has to be a digital, right? Digitally and physically both. So in terms of the brand management and also itself to healthier patients' habits, and eventually that higher patient adherence rates also is required, because it's a blend of both the things. So this is part of the engagement part. Second part is the advocacy. Advocacy, what advocacy means? Advocacy is basically that your product and the brand making a genuine positive impact on the health and the well-being of the patient, and the doctor is getting satisfied. So this is the part of the advocacy from both the ends. The third is adherence, because you all agree with me with this digital, phygital, and all, adherence somewhere is missing, right? So how we can make the things, both the things together, so that there should be a complete technology, data, and ensuring that the patient should be adhering part. So this is the three things which is very important. And these three emerging trends, consider that they're developing your patient journey map. So now coming back to the important part, that is what is the outcome based care, which is there. Patient want engagement and more information is always available. Where the three things are there, because you will agree with me that lot of the content marketing is available. Published researches, case studies are available. Maintaining a blog, website on the latest development, common questions, or the tips to overcome the side effects are available. Because patient, they keep on scribbling the things, right? Because before they going to the doctor, they become that 70% they are themselves doctor. But what are the actual things are there which is more important? Using the videos to demonstrate how to effectively use the certain products, like suppose injections are available, or suppose insulin pens are available, or suppose new pths are available, right? So how it has to be used, because many of the patients, they are illiterate and many of the patients are illiterate. So this is the responsibility, that how we are able to demonstrate the things. Live video, field actual patient questions on the fly, the interaction between the doctor and the patient, the live video, which may be a demo, which is going to help. Then also online forums with the expert that can answer the question about specific drugs. Because you know that all pharma company during the COVID time, they did such type of things. So small bites, 2 minutes bites are going to help about the thing. Launch a public Facebook or the LinkedIn group also. Twitter group, some of my friends, they said that Twitter is really coming up there. And also initiate the discussion on the topics which is there, so such as the mental health, agility, affinity, and all. And also that talking about the diet, exercise, on the efficacy of the treatment. So these are the things are there which are completely patient journey has changed. And this is the way we as a pharmaceutical company has taken up to build the brand, to build the connect, to build a complete 3 degree part, which is very important, that the triangle: patient, doctor, pharmaceutical company, to build our brand also and to go further ahead. So this is all from my side, which I like to highlight it here. Thank you so much.
Rajput sir, thanks for your valuable inputs here. And now I would like to invite Mr. Vaibhav Rao, and would like to hear his views on how we can leverage the power of artificial intelligence and analysis in improving the customer experience. Over to you, Vaibhav sir.
Yeah, thank you, Vishal. So, yeah, I mean, AI and ML, these are buzzwords, right? But the foundation of all this is data. So the right amount and the quality of data actually determines how these AI or ML models would actually run and benefit an organization first, and then towards, and their customers actually as well, and how the organization uses data to create these experiences using AI and ML. It's an interchangeable word. So yeah, typically, AI, ML, if you look at, and if you look at data, there are there are opportunities basically that you can use these models, simple as well as a complex model, to basically discover who your cohort or your patient or a doctor is, right? Build those persona types based on likes, dislikes, certain traits that they show, affinity towards a particular channel or content, etc. This is possible. This is what your machine learning algorithms will give you out of box, right? Completely, it's available. Then what is that, how do you utilize this to basically to your advantage and to your customer's advantage, to honest, how do you make that life simple for your customer? How do you make that information easy to access for your customer? How do you make it more relevant and personalized for your customer, is where AI and ML will come towards the end, right? So that's where most companies look to utilize these out of box services for their customers advantage. A good example that I always look at is Amazon, and I don't think anybody has done it better than them. Then there are so many touch points that our customers actually look at from an Amazon point. There is an Amazon retail app which we shop. There is now an OTT, Amazon Prime, which is available. Then there is Alexa that you can talk into. It's fancy, but it's there. What are they doing when they're actually giving these experiences? At the same time, they're also collecting information. They're collecting data about your likes, dislikes, preferences, what time of the day you're coming, what kind of content are you liking. And at the back end, I mean, sorry to get a bit technical, what they're doing is they're actually binning. Binnings is basically creating those buckets personalized or personas in which exhibit certain features or characteristics or traits, right? That's what they are doing. They're actually binning you, and they're creating digital personas or digital twins, as you may call it, right? Who's a person who's exactly like you? What are the likes, dislikes? What are the capabilities to spend? Is there also a digital intent to spend when they are online, right? So that's what they're actually creating. And after having done this, massaging of data at their end, that's where the model comes in and gives you the content which is a personalized, b empathetic to your need, and very simple to access. You don't have to click 5 to 6 places to get the content that you're looking at. You open your OTT platform today, that's a movie recommendation that you get that really hits the spot, right? You're looking for something like an action movie or a thriller, because you've been kind of browsing elsewhere on Google, or maybe or watching something which is similar of nature and on content, or maybe you're asked Alexa for something like this previously. So it's actually giving you when you come there. So excellent customer experience. Now coming to our industry, right, our pharma, we're learning from something like this also. And given the nature of our industry, which is a bit complex, right, and we are bound by compliances, and we are bound by certain regulatory laws that prohibits us to get direct access to any customer data. There are a lot of GDPR regulations that apply as well. So having said that, I know uh, Samir just spoke about earlier about creating a very nice learning experience for our HCPs. I mean, kudos, really, really great, and very heartening to hear that it's happening within the industry. But what happens also is doctors typically also look for other avenues now in this age, right? They are actually looking for maybe a peer-to-peer connect, a KOL connect. They're looking for online CME credit points to gather. They're looking at places where they can actually discuss patient case studies, all of that. So what has also happened, given that we are not also able to do that on our own platforms, this has given birth to another player actually in the industry. These are online communities of doctors. They are basically, you think of them as LinkedIn for doctors, right? They are walled garden gated platforms or communities where access is given after they have been validated that they are doctors. Their certificates are asked, they're taken, only then they get access to something like this. They're given free access to entice them. Once they are there, they have the opportunity to interact with their peers, as I mentioned, right? With to discuss case studies, do KOL connect, do CMEs, attend virtual conferences, etc. Now, these communities over the last 2 or 3 years have grown so big that they are now, having more than 400,000 to 500,000 doctors on them from various specialties and therapy areas coming there, spending almost 7 to 8 minutes on an average daily, right? 7 to 8 minutes, 400,000. Now you equate what kind of data these platforms are actually creating. And smartly, what they've done is they've again binned these individuals or HCPs who are coming on these platforms, created these digital persona types. They've understood which HCP wants what content and in what format. Do they like infographic? Do they like webinars? Do they like plain video, which is 2 minutes short? And at what time they come and consume that video? So for example, and they are now open to partnership with pharma company. So if a pharma company really wants to create a good customer experience through a pull channel, this is a good place to be, right? You come there, you serve your content, they will create modular content for you. For example, a cardiologist coming in from Mumbai at 8 a.m. and versus a cardiologist coming from Delhi at 8 a.m., both will see different content because they have different digital persona types. They have different preferences towards different content. And that's when if you place your content to them at that point in time, there is a high chance that they will engage with your content. They might just click and give you consent, and you then take them to your website and then engage them further, right? So it's a qualified lead. Your digital media spend is optimized, and your cost of customer acquisition is optimized as well, and retention thereafter, right? So this is where AI ML truly is coming into play, and now pharma is learning from them, these organizations, and also building that omni-channel experiences on their pharma owned channels, be it a website, be it Twitter or YouTube, wherever they're present, and touching base with our customers. So
Absolutely,
that's how
absolutely. With
we
you,
are learning
this
and
promises
growing.
that
Yeah.
that's true, that AI can really help enhancing the
Yep.
experience. And now I would like to have views from Mr. Rohit Garg on tools to measure the quality of patient and customer experience based on the feedback. Over to you, Rohit, sir.
Yeah, thanks, Vaibhav, once again. So I think there are various methods. I think some of them have already been talked about by the previous speakers in in response to other topics. So the some of the methods that we have seen people using it is like we heard from Rahul. I think is about A/B testing. So you kind of create two cohorts. One is you provide them experience A, and there is the another normal vanilla experience, and then you kind of do the testing A and B and see whether what kind of differentiation you are getting in terms of the customer feedback and how they're responding, and so on and so forth. So one is definitely A/B testing, which can help us. Second way, what people have used, and to some extent I have seen it, is also people using multivariate analysis, because you're dealing in a very complex kind of a system where too many variables are in play. So it's very difficult to isolate what impact customer experience has had on the customer feedback as such. But still, if you're able to identify certain variables, and then you do and you analyze the data over a period of time, and generate large amount of data, and you do the multivariate analysis, you would be able to find definitive trends and correlations, how to measure the customer experience and its effect on the feedback. And that people have used various techniques for that. It can be with the survey based, where you kind of administer a questionnaire, which is very very nicely designed. You have to think through a lot on the questionnaire to ask the right kind of questions, and then once you get the feedback, you can analyze their behavior patterns through the data, and you can analyze. So these are the two methods I have seen primarily using it. And I kind of put it like to open in the forum if anybody who can add from their experience, or how to use it. But these are the two methods I have seen people using it.
Absolutely, Rohit sir. I think you had absolutely good insights on this. And with this, we come towards end of our panel discussion. We had very nice views from everyone and all the panel members on the need for the customer-centric digital transformation, and how various technologies can improve customer experience. And would love to hear more on this. And I know that today is an honorable day to sit with so many of distinguished guests. Unfortunately, we are hard pressed for time, and really cannot continue. And now I would like to call Ekta. And since we are coming towards the end of this, and I think now is the time for question and answers. So over to you, Ekta.
Thank you, Vishal. Thank you. So it was, of course, an interesting session. So as Vishal mentioned that we have the speakers, any Q&A or any questions coming in your minds, or any final thoughts, from you guys, would really appreciate.
I would just like to add on. So when thinking about CX, possibly more on the strategy side, focus a lot on accessibility. So there are a lot of time when you look at the accessibility at the end, it means that your experiences also has to be very clear for people who are living with disabilities. Now that goes all for your employees, for your end customers. Uh, there are 7.7 billion people on Earth. 1 billion people are living with disabilities. But if you look at aging population, which is rapidly happening across all the countries, um, you can add additional 700 million to that. It is not a disability, but the way people use digital is different. Those small fonts, those fancy animations, somebody has a vertigo, epilepsy, those flashing carousels, they play a major effect, right? And there are serious legal concerns around that as well. Now, if you add their friends and family, that number of a billion goes to around 2.5 billion, right? So there is a huge number, and the reason I'm saying it is, um, for example, if a company is into a diabetes care, right? A lot of people who are suffering with diabetes have retinopathy and various issues related to eye itself, right? So they cannot see the screens very very clearly. So healthcare and pharma should have an additional onus in leading the space of creating digital experiences stunning experiences, but also accessible. So people who are living with disabilities, even temporary disabilities or attention disorders, or things which old human eye require in terms of digital experiences, they all are taken care of. So yeah, just that one aspect I wanted to add on.
Thank you, Rahul, for sharing your thoughts. Any other thoughts or questions? We have Saurav, we have Vishal.
Now you know that pharma people now they are talking instead of 3.0, 3.0, they are talking about 4.0 also. So that is the thing. There is a new transformation is happening, and it is not only directly with the SCP or the people, but it is also happening in the supply chain, because that is computerization is one of the part of it. Connectivity, visibility, transparency on the things, predictability, adaptability. This is all becoming as a 4.0 requirement in the pharmaceutical industry. So the complete paradigm shift is coming up, and it is going to align not only on ensuring the product, but it is also going to align that the last man of the society should get the product at the right time, at the right place, whenever and wherever it is required. So this is the new paradigm shift which is going to come, and people are working on that. Pharmaceutical companies are working on that.
Absolutely. I think Samir sir also has some interesting insights on artificial intelligence playing a role. Samir sir, would you like to share some more thoughts on that?
So AI has been a very integral part of us, in various technology. And Vaibhav has talked about Amazon, which is a very, very, very good example. I discussed earlier about Apple and all, but somewhere now the pharmacy kind of things, NetMeds, these people have a lot of information and data available, right? And the retail pharmacies, which we call it, they have the very detailed data of the patients. Those patients who are coming to them, they have even their tests and everything available. How much they go for allopathic kind of thing, how much of them choosing the Ayurvedic stuff is also available. I mean, which I can see with my experience of pharmacy or the NetMed, we are seeing it. And that's why you're seeing a lot of churning happening at that segment, because future somewhere they are going to play a very very strong role when we are talking of patient centricity, because you can, I mean, still it is not done. Not we have, I mean, we have just initiated, or maybe some companies have initiated, right? Or you talk about the Goku kind of thing, which is in India, and the Vishal is developing, the other Vishal, right, who is developing the entire devices and everything, which is surrounding on those things, which is getting the insight, because the Goku has its own platform of the device, of the goods, or the medicines, or healthcare segment things which you're going to buy. So what I'm saying, trying to bring it on the table, is that there is lot unexplored in the pharma space. And that change, because see, that much of technology and investment is required, and you require a people who have that ability to understand these things. Largely, if you look at an our segment, we have the digital people. I mean, again, I come back to the Indian and to the internal people, because I see that a lot of roadblocks at that their side, because we have to hire those competent people. They complement our knowledge, because we hire people whom we like, but then we have to hire somebody who has that ability to understand what algorithm is all about. I mean, we have been talking of creating algorithm, but their insights are not there. When I was working on certain projects, we were trying to get insights, and the guys is not able to bring a basic algorithm to experience, have a very good experience on a iPad with a doctor. So the capability investment from the company is much more required, hiring those right set of talent. And the data, huge amount of data is there. Now every majority of the companies have iPad, they have experiences, how many times, what kind of doctor using what much, I mean, where does he prescribe, and then you have their prescription and RCPA data as well in the system. There is very little model I have seen, or whatever is available is very in a bits and pieces, which integrates all the information and gives me insight ki boss, here is this customer where you can approach in this way, right? Or here is the segment of the customer, the cohort of the people is available of this kind of methodology, of the group. So as Vaibhav was talking, we have to take a leap from here. We started working, Data is available, but somebody has to use it to convert that thing into a proper output. That is currently that gap I see. That's my point, Vishal.
Here, Mr. Samir, I fully agree with you. And I feel that now the brand managers or the marketing heads who are coming, right? So how they are going to leverage the data? Because in our company also, because see, it is as a on a CXO level and all we cannot do. But the people who are the real driver and who are going to make the things happen, I have seen in our organization also the people who are so much on the data driven and they have the consensus on things and they make the thing happen. And some people they are not driven. So it depends completely. Here I will confine to think that the brand manager or the marketing head should be and is responsible to make the things happen because it is ample of the things are available in data. Lot of things because everybody has gone to digital and everybody is having the complete thing in that way. So on this platform, I would request that whenever the people they want to launch,
Agree.
people have launched the brands. Like I'm sure Shipla would have launched the brand. We have launched the brand, right? So many companies they have launched the brand. How? It's with the churning the data. Which area, which segment, how, which is the way, what is the marketing intent is there? Everything was added in that.
Thank you, everyone. So it was, of course, an interesting discussion. So before I wrap up, Vishal or Saurabh, anything that you guys want to share on final thing?
Okay. From our side, we'd like to thank everyone. And since we are connected on this wonderful technology, which also helps pharma and healthcare professionals, and Saurabh also talked about the video consultation. So what we are gonna do is like I'm personally will be sending you the trial licenses of this beautiful technology on which we are connected. So that's a token of appreciation from our side. And Saurabh, would you like to share some more insights?
Just one last point, which Rahul also mentioned. It's about the experience economy. I think I am a true believer that it is gonna be a experience economy. And I remember one quote by Maya Angelou. She was activist in the US. She said, you know, people will forget what you said, and people will forget what you did, but they will remember how you make them feel. And that's all about experience. And I think experience is what's going to drive the industry. With that, I would like to thank all of you to join with us today. Thank you.
Thank you, Saurabh. Thank you, Vishal. So, of course, on the closing note, I would also like to thank all the speakers, thought leaders, for taking out your precious time Friday afternoon and being here with us and sharing great insights. Of course, thank you, Avaya, for associating with us and giving us this opportunity every time to gather senior leaders across the industries, across the verticals. It's an interesting job that we do. And of course, we will be sharing the video with all the speakers, thanking them. And that's all for the day. Have a nice weekend. And thank you once again. Stay safe, everyone.
Thank you. Thanks, everyone.
Happy
Thank
Thank you
you.
so
festival.
much.
Happy festival to everybody. Bye bye.
Yes.
Bye.
Yes.
Thank you, everyone.
Thank you.
Yeah.
Bye.
Bye.
Bye.